Feeling cold on Wegovy or Zepbound can be real, but it usually does not mean the drug is directly lowering your temperature. In most cases, it means your body now has less fuel, less insulation, or both. Mild cold can be part of weight loss. Persistent cold with weakness deserves a closer look right away, not a shrug. Most people expect nausea, constipation, or less appetite. They do not expect cold hands, cold feet, or suddenly wanting a sweater in a room that felt normal before. That surprise makes many people blame the medicine alone. Usually, the bigger story is the body changing underneath them. The timing can also mislead people. The cold feeling often shows up after appetite drops, meals get smaller, or weight starts falling faster. In most cases, the body is reacting more to lower intake and faster weight loss than to the injection acting like a broken thermostat. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. One common reason is weight loss itself. Wegovy, semaglutide, and Zepbound, tirzepatide, help many people lose significant weight. Body fat does more than store energy. It also works like insulation. When that layer gets thinner, the same room can feel colder than before. There is an energy side to this too. When you eat less, your body often responds by using less energy. Less energy use means less heat production. In plain English, your body starts conserving fuel, and that can make you feel colder during faster weight loss or lower calorie intake. This is why the symptom is often indirect. The drug changes appetite. Appetite changes food intake. Food intake changes body weight, insulation, and how much warmth your body makes. By the time the person notices the cold feeling, the medicine can look like the whole cause even though several steps led there. The same chain helps explain why some people feel only mildly colder, while others feel weak and drained. The difference is not just the symptom itself, it is what else is happening with food, protein, strength, hydration, and day-to-day energy. The people who feel the coldest are not always the ones losing the most weight. Often, they are the ones eating too little, missing protein, skipping meals, and starting to feel weaker from day to day. The problem is not only the number on the scale, it is whether the weight loss is happening with enough food, protein, and steady energy from day to day. Movement matters too. People who feel queasy or tired often move less without noticing it. Less walking, less exercise, and less general activity mean less heat generated during the day. With lower calorie intake and less body fat, the cold feeling can become much more obvious even when no new disease is present. Mild cold during steady weight loss can fit normal adaptation. Cold that comes with weakness, dizziness, major fatigue, hair shedding, or getting tired much faster with activity fits a different story. At that point, not eating enough becomes more likely, and other causes like anemia or thyroid disease deserve consideration too. Older adults often notice this pattern sooner. Even a modest drop in food can make them feel weak earlier. They often start with less muscle, and they may already be getting barely enough protein, iron, or total calories. That does not make the symptom mysterious. It means the same appetite drop can cause the cold feeling with less warning. People who are already eating just enough to get by can notice it faster. A person who skips breakfast, eats lightly through the day, or avoids protein because of nausea may look fine on the outside. But inside, there may be less reserve to maintain strength, warmth, and stable energy. That is why the cold feeling can be an early clue rather than a random side note. Start with pattern, not panic. If the cold feeling is mild, the weight loss makes sense, and energy is still stable, normal adjustment becomes more likely. If the cold feeling is persistent, getting stronger, or tied to broader decline, the interpretation changes. That is the moment to stop treating the symptom like a harmless side detail. Then look at timing. Did this begin after a dose increase or during rapid weight loss? Those patterns suggest the cold feeling is coming more from eating less and from the body adjusting to weight loss. If there is no clear link, check whether food, protein, fluids, and regular meals have quietly fallen apart. The goal is not to chase warmth with random supplements, huge cheat meals, or guesswork. The goal is enough food, enough protein, enough fluids, and regular meals. A body that gets food at random times and in small, inconsistent amounts often feels colder and weaker. Small, protein-centered meals usually work better than waiting for normal hunger to return on its own. Hydration matters too, but in a practical way. Dehydration often travels with nausea, lightheadedness, poor intake, and a washed-out feeling. People sometimes describe that whole package as feeling cold or off. The thermometer may still be normal, but the body can feel stressed enough that the symptom becomes much more noticeable. That is why a normal thermometer matters here. Feeling cold is not the same as having a true low body temperature. It is also not the same as having a fever and chills. That difference helps people avoid blaming the medicine for the wrong problem. It also helps them notice when a different illness may be part of the story. If the cold feeling is mild and clearly tied to weight loss, first review whether your nutrition has quietly fallen apart. Look at protein, meal frequency, fluid intake, and side effects that may be suppressing eating more than you realized. If the cold feeling also brings chest symptoms, fainting, shortness of breath, or severe weakness, contact your clinician promptly. Even without urgent warning signs, there are times to ask for review sooner. One is when the symptom keeps getting worse or starts without much weight loss. Another is when the cold feeling appears with pale skin, major fatigue, or getting tired much faster with activity. At that point, another medical problem may be part of the cause instead of the medication alone. If the pattern points toward low intake, act on it directly. Eat more regularly. Protect protein on purpose. Do not let nausea turn the whole day into coffee, crackers, and almost nothing else. Sometimes the real problem is not the drug itself. It is a dose that outpaces your intake, plus appetite loss and underfeeding, that gradually leads to weakness and feeling cold. That is why slowing down, adjusting the dose, or getting a nutrition plan reviewed may matter more than trying to push through. Feeling colder on Wegovy or Zepbound is usually a fuel and insulation story, not a thermostat story. Mild cold can happen during successful weight loss. Cold with weakness, poor intake, or decline is different. That is when the symptom should stop being ignored. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.